Larkin FDA emergency use authorization of Delta-XG for severe COVID-19. COVID-19 causes life-threatening complications such as acute respiratory distress syndrome or ARDS. These complications are caused by an exaggerated immune reaction to the infection itself. Histopathologic examination of lung biopsies taken from patients with COVID-19 and biopsies taken from patients with lung cancer shows many striking similarities. These similarities include the presence of abnormal signature or SIG proteins in both the damaged lung environment of COVID-19 patients and the tumor microenvironment of lung cancer patients. Additionally, rapidly dividing cells are present in the immune cells in the damaged lung environment of COVID-19 patients and the cancer cells in the tumor microenvironment of lung cancer patients. Based on these similarities, Delta-XG could work as a treatment for severe COVID-19 induced acute respiratory distress syndrome or ARDS. Delta-XG is a disease-targeted, replication-incompetent, amphotrophic, MLV-based retrovector that displays a SIG-binding peptide on its surface for targeting areas of pathology. Additionally, it encodes for a cytodominant negative human G1 construct for killing rapidly dividing cells. When injected intravenously, Delta-XG nanoparticles seek out and accumulate in the damaged lung environment or tumor microenvironment where abnormal SIG proteins are exposed, in the vicinity of activated cells. Our guiding hypothesis is that Delta-XG would then enter the cells via their native viral receptors, integrate into the genome of rapidly dividing T cells and activated macrophages, and kill them by blocking the G1 phase of the cell division cycle, hence reducing cytokine release and the severity of ARDS. Delta-XG is currently available via an FDA-approved expanded access program for stage 4 cancers under the IND number 19130. The objectives of the study include to evaluate the efficacy and safety of Delta-XG in improving survival and hastening recovery from severe COVID-19 when standard therapy has failed. Patients and methods include first, obtaining an written informed consent prior to the initiation of study treatment, and then the collection of clinical status, hematologic and organ function assessments, chest x-rays or chest CTs, acute phase reactants, and IL-6, which will be assessed at baseline and as needed through the course of treatment. The route of administration for Delta-XG is Delta-XG will be provided intravenously at a dose of 1.2 times 10 epsilon 11 CFUs or colony-forming units daily for 7 days. The dose of Delta-XG was based on an approved calculus of parity ratio. An efficacy analysis will be completed through the treatment outcome parameters based on NCT 04292899 odds of ratio for improvement on a 7-point ordinal scale on day 14. The odds ratio represents an odds of improvement in the ordinal scale from 1, including death, to 5, hospitalized but not requiring supplemental oxygen. Safety analysis will be completed, and treatment of emergent adverse events from first dose up to the 10 days plus 30 days following treatment will be reported. Further, vector-related adverse events, including detection of RCR and PBLs, vector-neutralizing antibodies, and vector integration in non-target organs at 3, 6, and 12 months will be reported. If negative, yearly test samples will be archived for 15 years. All grade 3 or grade 4 toxicities will be reported in the clinical study summary report. In the event of death, an autopsy will be submitted, and if an examination was conducted, results will be presented.